simple. Life-saving aid must reach people quickly and without delays. I want to emphasize that the longer it takes, the weaker and the stronger the vulnerability gets, including fuel for hospitals, essential services. And again, Altaf will get into the health details. Acting fast and working together is the only way to stop the situation from getting worse. We can't afford another humanitarian crisis. We already have a stretched humanitarian situation on the ground across all sectors, from getting worse, and to protect those most in need in the months ahead.
The Cuban health system remains operational, but it is under severe and sustained pressure. Shortages, as outlined by my colleague, of fuel, electricity, medicines, medical supplies are critically disrupting a hospital's ability to function. This includes emergency care, blood banks, laboratory, immunization programs, maternal and child, as well as surgical services. The human cost, as outlined, is already significant and continues to grow. More than 100,000 patients, including over 11,000 children, are waiting for surgeries that have been delayed due to power outages or supply shortages. Around 5 million people are living with chronic conditions and are currently at risk of interrupting life-sustaining treatments, including 16,000 patients requiring radiotherapy and more than 12,000 patients currently undergoing chemotherapy. Maternal and child health services are particularly affected. More than 32,000 pregnant women faced increased risks due to reduced access to diagnostic services, as well as limited transport for obstetric emergencies. Neonatal care is highly vulnerable, as life-saving equipment depends on stable power supply, which is not currently sustained. Routine immunization coverage remains high, but is increasingly under pressure to the stability of the cold chain, limitations in transport, and supply disruptions.
Ambassador Waltz, for example, a few days ago,
Power outages are forcing health facilities to reduce vital services, prioritize urgent care, limit diagnostic and surgical operations. Fuel shortages are also limiting ambulatory services, referral capacity, and further restricting access to care. The impact extends well beyond health facilities. Disruption to electricity and fuel supplies are affecting safe water, food production, disruption to the cold chain, which all require fuel to function. Despite this, as mentioned by my colleague, healthcare workers continue to demonstrate resilience and commitment. This was most evident amongst the workforce that we visited in the hospital, where healthcare workers, who are also parents, are having to make impossible choices. Our priority is clear: sustain life and essential health services, protect the vulnerable populations, ensure access to energy, and ensure the provision of medicines and medical equipment.
To the press for questions. Yes, Edie.
Thank you.
La situación es pésima, que no le podemos hacer nada, son cosas que pasan, la solución no se ve. No te puedo decir más nada porque créeme que es bastante comprometedor decir si piensas algo esto. No te puedo decir más nada, no te voy a decir.
Ese problema de petróleo, no hay petróleo, ¿entiendes? Entonces tenemos que pagar la consecuencia esta que hay.
Eso está muy complejo y está afectando mucho, porque mayormente a los niños que no van a la escuela, porque imagínate tú, hay problemas de déficit de petróleo en el país, ¿ves? Entonces eso no está oculto, eso no es mentira. Y entonces la situación es que la economía estaba demasiado en el piso, entonces no hay inversiones para hacer nada. Y entonces eso es lo que hay.